Well, to continue our conversation, I thought it was important to get the man and one of the people whose onerous responsibility it is to make sense of the times that we are in. And therefore, my next conversation will be with the national coordinator of the Presidential Task Force on COVID-19, and that's Dr. Sani Aliyu. I mean, Dr. is an eminent microbiologist and spent a lot of years and work in the area of infectious diseases, including HIV and so on and so forth. Hello, doctor.
Hello, good evening.
Right. I'm just going to start by saying, why would you accept a job like this at a time like this?
Well, somebody has to do the job.
Yeah.
So, yes, I was invited. I was actually invited to come and help out. I've been in the UK for 20-something years so far, and I was head of NACA for some years before returning back to my usual base when I was asked to come and help out. And of course, there's no greater honor than working for one's country. So no matter the challenges, I think it's a good thing, and it's good to have challenges once in a while.
Excellent. Yeah. So, I mean, it's a good place to start from, talking about the UK and what's going on there and what's going on around the world. I mean, the country where you've come from, that's the UK. I mean, it's one of the most badly hit countries in the world. And in comparison to that, a lot of Nigerians feel still that COVID-19 is not a dire present danger for Nigeria. What's your opinion about that?
Well, when you look at it, the point I always put through is that this is a pandemic. It's very similar to having tuberculosis and malaria. This is a potentially preventable disease. It's just like saying, well, why don't we allow children to have measles? After all, malaria is more common than measles. And these are preventable illnesses. It's an epidemic we're in. And not only is it an epidemic, people are actually dying from it. It's a very severe illness when it affects certain individuals. If you look at our numbers at the moment, we're now running at well over 10,000 cases a week. Last week we had 10,300 cases for the first time. The highest peak we've had was in the first week of July, when we had 4,500 cases in July last year. So it's definitely increased. Even the deaths have increased. 77 deaths in just 1 week. More than 1,000 Nigerians having died from an illness that potentially can be prevented by people just following those public health measures that we keep on insisting on, such as wearing face masks, physical distancing, frequent use of hand sanitizers, or washing your hands with water.
Yeah.
And of course, avoiding mass gatherings. So it's a deadly disease. Yes, it doesn't kill everybody, but for those that it kills, it can be quite devastating. And even if you don't die from it, you can have long-term side effects. The youngest person in Lagos to die of COVID was just 27 years. And that's very young. And if you're above the age of 50 in Nigeria, up to 23% of those above the age of 50, based on our records, died. So it's quite a severe illness. It's not something that we should really say, well, it will be like malaria or typhoid. People do get better, and therefore it should be okay. No, because it's something that you don't really need.
What about the vaccines? How are we going to vaccinate over 200 million people, given the cost of the vaccines? The fact that you need 2 rounds, as we know of today, it might change tomorrow. It seems like we're in trouble.
Yes, it might change tomorrow. Of course, there's a vaccine, the Johnson & Johnson vaccine, that hasn't come out yet. It's actually 1 dose, so things might change. But you're quite right. The goal is actually not to vaccinate everybody in Nigeria. The goal is to vaccinate up to 70% of the population, because that's what you need in order to establish herd immunity. You need 70% to achieve herd immunity, and then following that, we would also we'll prioritize certain groups. So, for instance, we'll start off with healthcare workers, because they're the ones that are most at risk. After healthcare workers, the front line, so security agencies, etc., people who actually interface very closely with the general public, and also the elderly and those with diabetes, hypertension, people who are most likely to die if they catch COVID. We're not going to start with young people because really there's no need at that point. to do so. And the plan is we will vaccinate 40% of the population in 2021 and an additional 30% in 2022. Where is the money going to come from? That's one of the reasons why I said to you the fiscal space is very tight. It really is very tight, because I know this based on the negotiations we've been having with parts of government in terms of where the money could come from. But there will be a supplementary budget that would go to the National Assembly, hopefully in the next week or two, that would cover for that first 40%. 20% of the population would actually have the vaccine delivered free. And then the remaining 20%, we have to buy the vaccines ourselves with our own money. But even that 20% that will be given to us free in 2021, we have to find the money for the logistics. We have to find the money for paying healthcare workers for the delivery of the vaccines, etc. And then in 2022, the plan is that it will be put into the 2022 budget. Unfortunately, we didn't have the time to put it into the 2021 national budget, but it will go as a supplementary in the coming weeks.
Which 20% will be getting it free, and who will be the rest not getting it free? 80%.
No. So in 2021, we will cover 40% of the population. Okay. So 20% of that population, the first 20%, it will be free. The amount, 20% of our population is 40-something million persons. So that amount of vaccine will come in free from Gavi. We are not going to pay for the vaccine. And then another 20% we will have to pay. The government will have to buy the vaccines. But when it comes to the last mile, the vaccine will be given free to everybody in Nigeria. We will not charge people for it because it's a public health intervention. Public health interventions, you don't charge people because you want everybody to take it.
COVID is going to change the world. Everybody says the way we live, the issues of climate change, the issues of sustainability in every sphere, education, healthcare, public healthcare in particular, all of it are the front burner now. I'm not quite sure what the plan is for Nigeria.
So for Nigeria, one of the things that has changed, and I'm sure you've noticed it even for those outside government, is the priority has now changed to issues such as health. We were spending a lot of money on infrastructure, but it's very clear that for you to create wealth, you need to have a healthy population. And moving forward, I am very certain that the funding for health going into subsequent years will improve. That is, there are some spin-offs that we've had as a result of COVID. So for instance, the number of molecular laboratories we had in the country were just 3 or 4 when the COVID pandemic started. We now have virtually every state has capacity for molecular testing, which will affect things like Lassa. You'll be able to diagnose Lassa much faster. You'll be able to diagnose Ebola much faster. And even when it comes to the delivery of the vaccines, some of the primary healthcare centers that would be given the vaccination, they will have to be renovated. They will have to have running water. They will have to have electricity, such as solar electricity, refrigeration, etc. And healthcare workers themselves, when you look at the amount, we've trained over 35,000 healthcare workers on infection control. Almost 36,000. That's huge. And these are healthcare workers that span across the length and breadth of the country. So, and even when it comes to the vaccine, now that the vaccines are coming in, the private sector are already showing great interest in that. But overall, probably the biggest advantage, well, you can't have an advantage with a pandemic, but probably the biggest spin-off, I think, is the attitude change that people have. People have realized how important health is, how important it is to keep yourself safe, and also to value what you have, whether it's family or whether it's your work or whether it's your lifestyle, etc. Some of people were locked up at home for 5 weeks. So, a lot of people could have gone mad as a result. The moment you release them, suddenly people realize actually the things that we were worried about before actually didn't matter, because this epidemic far surpasses any sort of at any sort of scale of concern that we would ever have had. So yes, there are spin-offs. Yes, there have been things that we have learned from, and I hope we will be in a better position in the future to be able to manage future epidemics, because they will come.
Right.
Will come. Another pandemic will
I can imagine. Of course, that's a fact of life. I mean, I've got to go now, and I wasn't going to ask you the question about accountability anymore, because that's my job to find out. However, The last question I'd like to ask you is, when will this be over? When are we going to go back to normal, and what will normal be?
We will get back to normal. No pandemic has lasted forever, but if we follow the public health measures that we keep on talking about, wearing face masks, physical distancing, avoiding crowds, washing our hands, etc., and when a vaccine comes, making sure that if we fall within that group, we get the vaccine, this thing will be over within a year. I am very sure of it. But meanwhile, we just need to make sure that we keep safe, and we continue to take measures to avoid catching COVID.
Right. But talks very much.